Welcome back to Ultrasound teaching videos with Dr. Arshad Nadeem Awan. Hope you're all okay, you're all enjoying your life, you're all practicing ultrasound, and also you're helping community as well. Today my topic of discussion is endometrial thickening. This is a very important topic, and I'm sure many of clinicians are still confused if they are from the gynae background. So the measurement and the thickening differentials are a bit confusing. If they are from the radiological background, so again there is different criteria, and those who are practicing, so in the practice they will see all these measurements are different. So I have tried my level best to discuss all these discrepancies. So far the endometrial thickenings is concerned, it is related to phases of the menstrual cycle. Like in proliferative phase there will be different endometrial thickening because endometrium has started proliferating, so that's why it is called as proliferative phase. In the secretory phase, endometrial thickening is still different, and because of the secretory processes, because of the secretions, the endometrial get thickened, and the measurement will be different. And in the menstrual phase, as you know, there are two layers of the endometrium: basalis layer and functionalis layer. So in the menstrual cycle, functionalis layer started shedding, but only the basalis layer remain in persist within the uterine cavity. So again the endometrial thickening would be different. So that's, I have discussed all this in my topic, in my this YouTube discussion. The another point is, at what point we will consider what if there is thickening of the endometrium regardless of their processes, regardless of their menstrual phase. So the one is like in pregnancy, there will be intrauterine pregnancy, so there is changes within the endometrium and you will see endometrium thickening. In the ectopic pregnancy out of the uterus, uh, if there is pregnancy, so still endometrium will respond and it will get thick. So that's why you have to correlate with HCG and beta HCG level. If there is some abnormality like polycystic ovaries which give rise to increased estrogen level, so in case of increased estrogen level, again there will be thickened endometrium, and this could have been due to polycystic ovaries. And at the last there will be either endometrial hyperplasia, or there may be endometrial carcinoma. So how it will appear, how we will write on the report, how we will differentiate it from one another, how we will write our differential on the report. So start watching this video, I'm sure it will definitely help you. Normal endometrial thickening. As you know that endometrium undergoes through three main processes, three main phases: proliferative phase, secretory phase, and post-menopausal phase. In these three phases, endometrial response and endometrial thickening varies. But again, I would say here that there is quite confusion between academic measurement and radiologically measurement on the practical grounds. Beside this, it's also depend upon the patient's build, the uterine growth, the hormonal changes, and endometrial response to hormone. This measurement which I'm giving here, it is academic measurement. In respect to any academic writing, you have to take into account this measurement. In proliferative phase, it should be 3 to 5 millimeter. But again, I would say here this measurement varies from 3 to 10 or less than 10. So this would be considered as a proliferative phase, and again proliferative phase would be divided into early proliferative phase and late proliferative phase. So from 3 to 5 would be considered as an early proliferative phase, and more than 5 would be considered as an late proliferative phase. As far as secretory phase is concerned, here it is given as 5 to 6 millimeter, which is, again, I would say this is academic approach. As far as practical approach is concerned, it is quite different from this. It may vary from like 8 centimeter until 18 until 20. So the secretory phase must be considered up to 14 and 15 on the practical ground. But while you are writing academically, you must write the way they have mentioned here. Secretory phase must be from 5 to 6 millimeter, and again it is divided into late secretory phase and early secretory phase. So far postmenopausal thickening is concerned, it should have been less than 4 millimeter, or on practical basis we can say that it should have been less than 5 millimeter. Any measurement more than 5 millimeter in postmenopausal women would be considered abnormal. The endometrial thickening may be increased in early intrauterine pregnancy. If you come across any increase or thickened endometrium, must look for the intrauterine pregnancy. This would be early intrauterine pregnancy and correlate with the pregnancy test and beta HCG level. If there is any ectopic pregnancy, so the endometrial response would be definitely increased and there will be thickened endometrium. So always look for the surrounding area for the ectopic pregnancy and correlate with beta HCG and pregnancy test. If there is any estrogen excess due to polycystic ovary syndrome, so because of polycystic ovaries there will be increased estrogen level, and because of the estrogen response the patient's endometrium will be increased. There are another condition which is called as endometrial carcinoma or hyperplasia. So this hyperplasia may be benign or may be malignant, but you have to be very careful and always advise further estimation, further workup. In case of endometrial polyp, if you are doing transabdominal scan and you come across thickened endometrium, so always go for the transvaginal scan to confirm whether there is some polyps or not. Ultrasound screening for endometrial carcinoma, so it should have been kept in mind that a cutoff value of 3 millimeter gives a negative predictive value. So far the histology is concerned, it is very important to distinguish between any of the malignant processes within the uterine cavity in respect to endometrium. So these were all the conditions where we discussed about the increase or thickened endometrium. Always take the patient's history, always look for the pregnancy test whether it is positive or negative, look for surrounding ectopic pregnancy, always look for the polycystic ovaries because it is one of the causes for the thickened endometrium, and at the end look for the endometrial hyperplasia, endometrial polyps, and then at the last your concentration should be on the carcinoma. So if you come across all these thickened endometrial patterns, advise DNC. Dilatation and curettage, one of the process through which we can take the sample of the endometrium for the histopathology, and on the basis of the histopathology we can find out whether this hyperplasia is benign nature or it is of carcinomatous nature. Look for the polyp, whether there is any malignant potential in there or not. So this was a clear differential diagnosis of the increased thickened endometrial lining.